Welcome to This Explainer. Today, we're diving into what is honestly one of the most profound structural shifts in modern public health. For decades, our global approach to medicine has been pretty reactive, right? We basically wait until people fall ill to intervene. But today, we're going to explore this monumental paradigm shift from a reactive medical model to a highly proactive socioeconomic health paradigm. We aren't just talking about building better hospitals here. We're looking at a credible academic framework for fundamentally redesigning the way our societies operate to generate health from the ground up. To really grasp the gravity of this shift, we've got to look at the data. Just look at this staggering projection, 60 million. According to documentation from the World Health Organization, elevating our global health structures through this new paradigm could save up to 60 million lives and add an average of 3.7 years to global life expectancy by the year 2030. That is an absolutely immense metric. We're talking about millions of people living longer, healthier, more productive lives. But how exactly is a number of that magnitude even achieved? Here's our roadmap for today. We'll start with the 60 million lives question, move beyond the front door of our healthcare systems, and then break down the three pillars of primary healthcare. From there, we'll explore health beyond the hospital, connect these principles to global health goals, and wrap up with how this framework future-proofs our society. Let's get right into it. Section 1, the 60 million lives question, and the data behind the global health paradigm shift. So, how are massive life-saving metrics of this scale even possible? Well, the answer actually lies in clearing up a widespread misunderstanding regarding our terminology. Which brings us to Section 2, beyond the front door, deconstructing healthcare assumptions. To truly grasp this paradigm shift, we first have to untangle the common confusion between two critically linked concepts, primary care and primary health care. They sound almost identical, but structurally, they operate on completely different scales. Now, this analogy brilliantly illustrates the core difference. Think of primary care as just the front door. It's the clinic, the local health station. It's that initial medical contact you make when you are already sick. It essentially functions as the entrance to the system. But primary health care, often abbreviated as PHC, is the whole house. It encompasses the entire socioeconomic structure, the policies, the environment, and the community systems designed to keep you healthy from the very start. Constructing a front door is definitely necessary, but it's not going to protect you from the elements if you fail to build the rest of the house. Moving to Section 3, the three pillars of PHC, the structural foundation of primary healthcare, we need to look systematically at the specific mechanisms that actually hold this expansive whole house structure up. So, primary healthcare is built upon three distinct pillars. Pillar 1 is integrated health services, covering everything from health promotion and prevention all the way to treatment and rehabilitation. This is exactly where our front door medical clinics reside. But here is the crucial point. The second and third pillars completely expand health beyond the clinic and into society. Pillar 2 is multi-sectoral policies, which means taking action across all government sectors, not just the health department. And Pillar 3 is community empowerment, where individuals and local communities actively participate in making decisions about their own health. Section 4, health beyond the hospital and the power of multi-sectoral action. Let's dive deeper into this second pillar, because it requires us to accept a pretty radical academic concept, that our health is not determined by the hospital alone. In fact, some of the most impactful healthcare work happens far away from any medical facility. What's really fascinating here is how entirely non-health sectors map directly to vital public health outcomes. Think about it. When the Ministry of Education rolls out high-nutrition school lunches, that is fundamentally a public health action. When an urban planning department designs public parks and accessible green spaces to encourage physical activity, that's a direct public health intervention. The data proves that an urban planner or an education minister is effectively operating as a hidden healthcare worker. They're creating environments where people thrive without requiring medical intervention in the first place. And this quote perfectly captures the whole essence of our analysis today. We are shifting from designing a system to treat disease to designing a society to create health. True health is built proactively into the fabric of our cities, our transit systems, and our schools. By adopting this structural approach, we are actively saving lives long before individuals ever need to reach for the front door of a hospital. Section 5, reaching global health goals, connecting foundational concepts to macro outcomes. Understanding this local, socioeconomic foundation lets us zoom out and apply these exact same concepts on an international scale. This structural approach is precisely what fuels major global targets like the Sustainable Development Goals and universal health coverage. Let's clearly define what we mean by universal health coverage, or UHC. It's a critical global health objective aimed at ensuring all people have access to the quality health services they need, without suffering financial ruin or bankruptcy to obtain them. UHC is fundamentally an issue of social justice and equity. It's based on the basic principle that receiving quality care shouldn't precipitate total financial devastation. And the key takeaway? UHC is completely impossible to achieve without a robust foundation of primary health care. In structural terms, to bring back our earlier metaphor, building more front doors without building the whole house will unequivocally fail to reach these global health targets. If we just allocate funds to more clinics or more hospital beds, but we completely ignore the broader social determinants of health, things like nutrition, education, and our environment, we are guaranteed to continually fall short of these challenging milestones. We have got to build the whole house. Finally, Section 6. Future-proofing our society, building resilience against tomorrow's crises. Why is this structural shift absolutely critical right now? Because it's not solely about managing our day-to-day health. It is fundamentally about the future resilience of our society against sudden, catastrophic global shocks. The academic source material makes this explicitly clear. A robust, interconnected primary healthcare system was the defining factor in how well nations survived and recovered from the COVID-19 pandemic. When you already have an empowered community and multi-sectoral policies in place, your society essentially has a built-in shock absorber. Primary healthcare is the critical key to health system resilience, enabling a rapid, effective response when the next major crisis strikes. So, as we wrap up this explainer, I want to leave you with this final, provocative question. Given the sheer intricacies of building the whole house of health, how will non-health sectors prepare our system for future crises? How must our educational, environmental, and urban policies evolve today to genuinely defend our society's health moving forward? It is a massive structural challenge, and it demands an answer from every corner of society, not just from medicine. Thank you so much for joining me to unpack this profound paradigm shift. Keep analyzing these critical global questions, and I'll see you next time.